Unfortunately, as you can see, no sign language interpreter. I can say there will be a limited transcript of the live webcast on our the Ministry's YouTube channel, and a full transcript will be available as soon as possible after we finish. So today, there are 25 new cases of COVID-19 to report. 23 of these are imported cases at the border, and 2 are cases linked to the port worker that we reported on Sunday, and they are workplace contacts. I'll start with those workplace contacts. The first case I'm reporting today was previously considered a casual contact of the port worker when we announced that case on Sunday. This person, who is in the small firm that the initial case works for, had a very short exposure to the case on Friday morning when they became symptomatic. That's the initial case. Really, we're talking about a few minutes in the same room. This new case that we're reporting today became symptomatic yesterday and rightly was tested and has returned a positive result. They have 1 household contact who is now also being tested and will obviously be in self-isolation for the 14-day period. The second case, that is a workplace contact, actually came into our database after 9 a.m. However, we're making an exception and we are reporting the case today because there's obviously a lot of interest in this particular case, and it's important that people know as soon as we have the information. So this person is the previously reported workplace close contact of the initial port worker reported on Sunday, and the person has been at the jet park since Sunday. They had been tested on Friday as part of the routine workplace testing at the port and returned a negative test. And that was on top of a number of previous negative tests as part of the routine surveillance testing at the port. The person developed symptoms on yesterday and was swabbed yesterday and has now returned a positive result. His household contacts were contacts of contacts, but we had, as an extra precaution, isolated and tested them anyway. They had returned negative test results. They're now considered close contacts, so we'll complete the full 14-day self-isolation and be retested as part of that routinely, or if they develop symptoms. And obviously, further interviews are underway with both our 2 new cases. They are well contained and had already been spoken with, but just to see if there's any further contact tracing that needs to happen, and we will update that if there is further information. Infection via the Safrana Seville ship, which the original case worked on, continues to be the most likely hypothesis for where this infection originated. But of course, we're keeping an open mind, and that ship is currently in Brisbane. Testing has been done. We don't have any testing results to report today. If they come in, we will report them. If we get some results today, we will report those out of cycle. There are 19 crew members, and we will report those as soon as they become available. I'm moving now to the situation in the Christchurch Sedema Managed Isolation Facility, which we reported on yesterday afternoon. When we reported yesterday afternoon, we had identified and confirmed 11 cases. There are now a total of 18 cases in that facility amongst the Russian and Ukrainian fishing boat crews who all came in on a chartered flight that originated in Moscow, flew to Singapore. They remained on board in Singapore and then flew through to Christchurch and have been in that managed isolation, which is dedicated just to that group of 235. All were tested pre-departure, and in fact, 2 people didn't get on the flight out of Moscow because they returned a positive test. Our current information is that that testing was not rapid testing, it was the nasopharyngeal swabs with PCR testing. We have now got a number of the actual results from that testing, and we're going through just checking and matching with those who we now have as positive results. The initial impression is from looking at the CT, the cycle threshold values, is that some of those cases we have identified in that 18 are new acute cases, and some are probably historical infections, just looking at the CT values, but we are also doing serology testing to help us build the picture there. Those positive cases have now been moved into a dedicated quarantine wing in the same hotel in the Sedema. There were rooms set aside in case they were required. Anyone who was in a room with a case is obviously being followed up as a close contact. They are now in single rooms. Most of the people in that group are actually in twin rooms in the hotel, and we are looking at the moment at the risks of potentially moving them into single rooms, and including whether we need to use additional facilities. And we'll be talking with our infection prevention control colleagues down there and the managed isolation facilities. We are adding an additional day 6 testing for all those people, and that will happen tomorrow, because we want to be sure that there hasn't been cross-infection either on the flight or inside the facility, so we'll add that in. And we're fully expecting that this group may need to stay for additional days beyond the 14 days, just because of the nature of the number of infections and the nature of the double 2 people in 1 room arrangements there have been in there. All staff at the facility have been tested over the last 3 days, and we're going to add in some additional testing for staff members, and their families are also being offered testing should they wish to take that up. People at the airport where the travellers arrived into, which was obviously Christchurch Airport, being asked to be tested if they haven't already been tested in the last couple of days, and the bus company that transported them to the managed isolation facility from the airport is testing its drivers. We have some other imported cases to make up our total of what is possibly a record 25 cases. We haven't had that number for a while. So there are 3 unrelated imported cases who arrived from London via Singapore on the 16th of October and tested positive at the routine day 3 testing at managed isolation in Christchurch. What we are now doing, I may have mentioned this yesterday, is a sort of a little investigation on every case we find in managed isolation, particularly looking at the CT values, just to identify whether these are likely to be acute or historic cases, particularly as we've had a number of recent cases that have only been picked up at day 12. And obviously the thing we're alert for is a positive day 12 test raises the potential of some cross-infection inside the managed isolation facility. So we're wanting to rule that out by checking if these cases have a high CT value and they're asymptomatic. It's very strongly suggestive of a historical case, which again reduces the possibility there was cross-infection inside the facility. So in addition to those 3 cases that are in managed isolation in a different facility in Christchurch, there are further 2 imported cases in managed isolation facilities in Auckland. The first of these, a person who arrived on the 16th of October from Jordan via Dubai and Kuala Lumpur and tested positive at routine day 3 testing. The second person, and the final case I'm talking about today, arrived on the 17th of October from Malaysia and tested positive also at routine day 3 testing. Both those cases will now go into the Auckland quarantine facility if they're not there already. So in summary, and it's rather stating the obvious, but we have a large number of cases today. 2 contacts, 1 close and casual contacts of the community case that we announced on Sunday. All appropriate precautions have been put in place there. The others are all in managed isolation facilities, a number of them in a single facility and associated with that charter flight for the fishing crews that were brought in. They have been captured through our procedures at the border and are well contained. And that's exactly why we have the protocols and procedures we have in place. So we find these cases and contain them at the border. So just a summary then of the overall numbers. 2 previously reported cases have now considered to be recovered, and this brings our total number of active cases now to 56. The total number of confirmed cases is 1,556. And yesterday, the labs processed 6,308 tests, and the grand total is now 1,040,911. I think that all of these cases, including the case we identified and announced over the weekend, who became symptomatic on Friday, as well as one of our contacts who became symptomatic yesterday, reinforces our critical message. If you have symptoms, do not go about your usual business. Get a test, and that is a really key part of how we will continue to have an effective COVID-19 response. Getting a test quickly allows us to then rapidly identify any contacts, isolate and test them, and that is instrumental in us being able to contain any potential onward community spread. It's also important people continue to keep a record of where they've been. Please use the NZ COVID Tracer app. I know that for those of you who do, it's always a surprise when you go back and look and think, gosh, I wouldn't have remembered I did that 13 days ago. And my final comment is just, again, putting our 25 cases today in perspective. Yesterday, Spain announced around 48,000 new cases, and that would be the equivalent of New Zealand announcing nearly 4,000 cases in one day. Spain is among a number of European countries that are experiencing well over 1,000 new infections every day and are implementing quite significant restrictions on movement and or going back into quite significant lockdowns, Ireland being a good example of the latter. So we have a significant pandemic. It's not going away anywhere soon. We have done well so far, but all that matters now is what we do now and what we do next, and we all need to play our part in that. We cannot afford to be complacent. We are not being complacent at the end of managed isolation, and all New Zealanders need to make sure we are not being complacent in our communities here in New Zealand. We want to remain in the current state we are, which is a high level of confidence we have eliminated community transmission of COVID-19. I'm now open to questions.
Seafood New Zealand went above and beyond regulations and tested crew before departure. We'd like to see that added to regulations for essential workers coming out to New Zealand.
Well, I think what we've got here is a really good opportunity to look at the value that pre-departure testing adds or not. And one of the things that's quite pertinent here is, and we're going through all the results, but it seems that all these workers did have pre-departure testing. Now, often that has to happen a few days before departure, especially if it's a PCR test, to get a result before they embark. And now what we've got is a number of positive, clearly announced here at day 3, that were negative on pre-departure testing. So what it suggests is pre-departure testing may add some value, but it won't change anything that we do at this end. And so I think the regime we have, without 14 days in managed isolation, plus our day 3 and day 12 testing, continues to be the mainstay of how we will keep the virus out of New Zealand.
Are there tighter restrictions for the next lot of fishermen coming in?
Are there tighter restrictions? We will, again, the system is working here, and whilst there may still be the expectation of pre-departure testing, it won't change anything we will do at this end, which will be following absolutely rigid infection prevention control protocols and the testing.
Sorry, jumping back to the test, can you explain to us how reliable those tests are or their method?
Well, this is one of the challenges around pre-departure testing, is we don't have any ability to assess the validity, either the process or the swabbing or the laboratory or any rapid testing process. So it does seem that the testing, and Caroline might want to comment on this, the nature of the testing that was done actually in Moscow.
We're actively following that up, but from the information we've got, it does appear to be a standard PCR test, a nasopharyngeal swab, and the real value of the pre-departure testing is when they test positive, because obviously, and that's what happened in this situation, those individuals then were not allowed to board the plane and come to New Zealand. But for the negatives, we just do not have access to that information to say really what is the accuracy of that test in another country.
And officials there being quite forthcoming with the information that you need?
I'm not aware that there's been any issue.
Is that the CR testing we talked about, does that indicate that people got infected on the flight?
The value, the cycle threshold, the CT, it's hard to know. What it indicates is that if they returned a negative test there and it was a good test in Moscow, they got infected sometime after they were swabbed. Now that could have been before they boarded the plane. At least one person must have boarded that plane who was infectious, and there may have been transmission on board the plane. There may have been transmission once they arrived here. But the important thing is we do everything the same anyway, and the fact that we found these infections is absolutely the system working.
Well, do we know it's been said that they've had to have a 2-week isolation as well as the pre-departure testing? Is that, or is that something that...
My understanding is that they self-isolated for 14 days. But again, I think
we don't know that.
Our view would be, regardless of what self-isolation and or quarantine arrangements might have been in place before people hopped on the plane, and whatever the testing results is, we treat them exactly the same when they come here, because we've got real confidence in our systems here, both the integrity of the managed isolation and the value of the day 3 and day 12 and additional testing if needs be, as well as the daily symptom checks.
What do we know about the
given
cruise?
given that, that the incubation period is really 2 weeks and they needed to test negative before coming here, the likelihood that someone was infectious on the plane, does that sort of indicate that maybe not everyone was self-isolating?
I couldn't pass judgment on that, but I think our assumption is, and we know that even the people with the best sort of supportive environment, it's quite hard to self-isolate really rigorously at the same degree of integrity as we know we've got in managed isolation, with that constant use of PPE, the real discipline around infection prevention control, the cleaning and so on. And that's why, one of the key reasons why in early April we moved from self-isolation at home here in New Zealand to managed isolation.
So given all this,
you're still comfortable that the next flight of fishermen should come to New Zealand?
Well, at this point, and we're liaising with both our fisheries colleagues and obviously those in charge of managed isolation. We will learn again from this particular scenario. The key thing will be the timing of that flight to make sure, because the same facility will be used. So we'll obviously need to make sure that we are confident before anyone leaves that facility that's there at the moment that they are free of the virus.
And any of these, this cohort, are any of them, needing medical care, nearing hospitalisation? Have you had communication with Christchurch Hospital over it?
I haven't had any of that information yet. So far, my understanding is that they're all able to be in the quarantine facility in Christchurch.
And are you still investigating active cases amongst that cohort, or have you gone through all of them now?
Amongst the cohorts,
they've all had the first round of testing, which is how we've picked up these positive tests. And then those who tested negative will have a second round of testing tomorrow, day 6. And
not contacted them about the infections and they learned through the media. Why is this?
I would have to look into that. In fact, one of the reasons I became aware of this was because my understanding was that Zealand had already sent some communication out. So regardless of how the system worked, we got positive test results. I've got actually a detailed timeline of when the public health folk in Christchurch notified our team, which was about 10 minutes after they had found out the results. And you would have seen that out of cycle, we actually made an announcement yesterday afternoon because of the importance of getting this information out there.
When did the fishermen go into isolation and when do they?
Friday was when the flight arrived, and so that's effectively their day 0. But because of these infections, and we will be looking at whether actually the clock may need to be reset because we've had this quite large number of infections.
Do you